hospital to here. The hospital releases them. At what point are they released from the hospital?
Sure. So hospitals have discharge criteria to ensure that patients are sick enough. Excuse me. Let me start again. So hospitals have typical discharge criteria to ensure that patients are well enough to safely be outside of the hospital setting. For most people, that involves going back home, but in some situations, there might not be a home setting that's safe for a patient to return to. And so a case manager in a hospital would identify that scenario and refer the patient to us for evaluation if they are appropriate to come to this facility.
So they're here in this, they'll still be COVID positive.
Yes. So in general, once a patient is tested positive for COVID, they need to remain isolated from others for at least 14 days. And so we expect that patients might be here for as many as 2, sometimes 3 weeks before they are safe to again be around others.
Since there's a lack of testing, are you guys making these decisions based on presumed infection rates?
These patients would all be tested and confirmed positive.
Okay.
One of the high-risk populations that are prioritized for testing are those in vulnerable populations who live in communal settings or are homeless, reside in shelters. So this population would all be confirmed positive.
Go ahead.
No need for IVs or respirators here. These are all folks who are
Right.
beyond.
Right. So this is a low acuity medical setting. We would not have ventilated patients here. There are a set of medical supplies that come along with this federal medical station. It does include things like IVs in the event that a patient needs that, but we would not expect most patients here to need that level of acuity.
Can you talk about the switch initially? On Monday, we were thinking patients that didn't have COVID or test positive for that. What was kind of the rationale between moving from that to this?
Sure. So in the current situation of the public health order for social distancing, there was a risk of putting patients into such a facility who were COVID negative. We didn't want to expose individuals to someone who might not have been identified yet as COVID positive, and so we decided that it made the most sense to have COVID positive individuals here who are already infected and therefore don't have to be social distanced from each other.